Keto and Mediterranean eating regimens both help with supervising glucose, yet keto may have more secondary effects, according to Investigate. A low-carb keto diet and the Mediterranean eating routine might both help anytime at any point regulate glucose, another survey finds. The two weight control plans are high in vegetables and low in sugar and took care of grains, preventing glucose spikes. However, keto Weight Watchers had more raised cholesterol and a harder time sticking to the eating routine, experts said. A high-fat, ketogenic diet. Likewise, a high-fiber, Mediterranean eating schedule may be comparatively practical for changing glucose levels, according to a survey disseminated May 31 in the American Journal of Clinical Nutrition. Investigators from Stanford University looked at data from 33 adults with prediabetes or type 2 diabetes to see what two exceptional 12-week diet undertakings could mean for their glucose levels and various markers of prosperity. The solicitation for the weight control plans was for arbitrary reasons given out, and individuals were told to eat whatever amount they cherished. On a particularly sorted-out keto diet, individuals were told to eat between 20 to 50 grams of carbs every day, moderate proportions of protein, and something like 3 servings of vegetables. The other decision, a Mediterranean eating schedule, relied upon standard dietary examples in countries like Spain and Italy, with most plant food sources, olive oil, oily fish, nuts, and seeds. The two eating regimens incorporated a ton of non-exhausting vegetables like a plate of mixed greens, and limited added sugar and refined grains like white bread. What is important was that Mediterranean Weight Watchers in like manner ate beans, normal items, and whole grains, while keto calorie counters by and large banned those food assortments to keep their general carb utilization low. The researchers found individuals had similarly additionally evolved glucose levels after the two eating regimens diverged from before the survey, and besides lost a restricted amount of weight. The disclosures propose Mediterranean and keto are comparably sensible frameworks for administering glucose in people with diabetes or prediabetes. In any case, the keto diet may have a couple of secondary effects, while the Mediterranean eating routine may be more direct to stay aware of over an extended time, as shown by the trained professionals. Keto Weight Watchers could have more raised cholesterol, miss specific enhancements, and gain a few harder experiences sticking to its long stretch. While the keto diet additionally fostered individuals' glucose levels, it in like manner raised cholesterol, which can be associated with a higher bet of coronary ailment. The high-fat substance of the keto diet, particularly accepting that it's drenched fat from sources like spread, red meat, and dairy, has as of late incited stress from cardiologists and other clinical experts who worry about the long risks of the keto diet. Nevertheless, keto Weight Watchers had lower greasy oils, another sort of fat associated with heart clinical issues, which could let the risks free from more raised cholesterol, some evidence suggests. Another reasonable issue with the keto diet was that individuals were eating in a general sense less unambiguous enhancements, including L-ascorbic corrosive, folate, and magnesium. Keto calorie counters moreover ate less fiber, an enhancement associated with strong handling and lower danger of consistent sickness, while the Mediterranean eating routine on a very basic level extended fiber utilization. Finally, experts found the Mediterranean eating routine was basically more clear for individuals to stick to. Keto may be trying to help since Weight Watchers need to follow starches eagerly and cut out a wide grouping of food assortments, experts as of late told Insider. Overall, the revelations propose it may not justify eliminating strong high-carb food sources on a keto diet, and a Mediterranean eating routine could end up being better for by far most, though sound low-carb diets may be a common-sense decision, as demonstrated by the trained professionals. There should be less focus on propelling one explicit eating routine methodology as best, and, rather, grant patients to make an informed choice to help them with spreading out which approach is for the most part sensible for them, the experts wrote in the review.